Mindfulness is a very complex thing, and there is wonderful research being done about how it works and the impact it can have in our lives. But it's more than that. There is also an art to it. Hi, my name is Ted Meissner, and welcome to Mindfulness Voyage. Glad you could be here. And today we're going to speak with someone about a resource that includes both the science and a bit of the art on mindfulness. Please do remember to subscribe to the podcast, and let's talk with today's guest. Our guest today is Linda Carlson. Linda, welcome to the podcast. Good to see you.
Yeah, it's great to be here, Ted. Thanks for inviting me.
And I'm so eager to be talking about what we're going to be talking about today, but I'd first like to give you a chance to maybe just give a brief introduction about who you are for people who might not have encountered you before.
So how philosophical should I get? Who am I? Well, I'm really nobody. So my name's Linda Carlson. I am a clinical health psychologist in Canada at the University of Calgary. I specialize in psychosocial oncology, which is working with people who have had cancer and their family members. And my area of specialization within research is mind-body therapies. So of course, that includes many years of mindfulness, clinical trials, and program development. I'm also a mindfulness-based intervention teacher. I've been doing that for about 25 years and a professor at the University of Calgary.
Thank you for that overview. And I'm also kind of curious what brought you to mindfulness, because that's a particular area of study, a big one, but it's also fairly unique in lots of different things you could have followed up with.
Sure. I think I just followed my heart and my interests. And specifically, I did graduate studies at McGill University in Montreal in the early 1990s. I was in my early 20s. But prior to starting grad school, I spent a year traveling, as many people do, backpacking around Europe and just broadening my mind, meeting new people, trying new practices, and always had a very, a drive for novelty, I guess, to see new places, meet new people, get to know new cultures. And it was kind of popular around then, some popular sort of books around mindfulness. So I remember picking up the Tibetan Book of Living and Dying was the thing at the time, and it got me curious. And then I went to grad school, and it turned out that one of my classmates in the clinical psychology program, which is very small cohort, had just spent 7 years in Thailand studying as a Buddhist Vipassana monk. And he literally had the shaved head and had been ordained and decided to come back to society and become a clinical psychologist. So he was right there on my doorstep. And I was like, wow, I should take advantage of this learning opportunity. And so he started a practice group, a Sangha, of McGill students. And we practiced every week I was there for 6 years and studying clinical health psychology. So psychoneuroendocrinology I was studying, hormones and behavior. So the mind-body connection, always an interest of mine. And then I had an opportunity for my internship to one of my placements. I came back to Calgary, which is where I was from, missed the mountains. And I'm still in the mountains, in fact, and I did one rotation at the Cancer Center. And so met my colleague, Michael Specka, and the program director, Barry Baltz, and Michael was interested in developing some kind of intervention for our patients that incorporated meditation and yoga, because he was a practitioner as well. And I had met Jon Kabat-Zinn at McGill in 1995. I often say I'd eaten a raisin mindfully for the first time. And I knew about MBSR, and I'd read Full Catastrophe Living, and I jumped at the chance. I said, we have got to do this. And so we adapted MBSR, taking in elements we knew that would be important for people going through cancer, loss of control, uncertainty, mortality, all kinds of cool existential stuff. And we developed that program. And so that's how I got into that line of research. I never left and just continued on and expanded to other kinds of complementary mind-body therapies, and I'm still plugging away at it.
Thank you for that overview. And it's so fascinating to hear the different ways in which people encounter mindfulness and the things that show up in our lifetime and the people who really help us along the way.
Well, and the person who brought Jon Kabat-Zinn to Montreal was Kirk Brown. I don't know if you know Kirk, but he developed the Mindful Attention Awareness Scale, which was the first and most commonly used measure of mindfulness, right?
Nice, nice.
Yeah.
Well, we are here primarily to focus on your book, which is now in its
Which I have
third
here.
edition. It's there, wonderful. And for those who are are watching this or listening to it on whatever platform you're on, I have a link in the description to that third edition. And an important, it's the third edition, not the other editions you will find elsewhere. So I've got that particular link available for you. And I'm wondering, Linda, if you might tell the story of how this book came about before we dive into what's in there and why
Sure,
it's
sure.
helpful for
And I
people.
said to Ted before we started recording, I said, I'm so excited you want to talk about this book because I've done other podcasts, but it's usually about my research. And I'm like, no one's ever asked about the book. And so I'm really excited to talk to you about it. And it's a great story, too, about the relationship between me and Shauna Shapiro. Because Shauna and I met, and again, one of these early defining moments, I think, even for the entire field of mindfulness, we met at a workshop in Toronto. I think it was around 2000. I was going to look up that paper, but it was around creating an operational definition for mindfulness. And so there was a group of people there. Zindel Siegel was there. Michael Specka and I were there. Mark Lau. Gosh, who else? Other people who, there weren't that many people. Oh, James Carmody was there. Jim Carmody too. Anyway, so we sat down for 2 days and we talked about what are the essential features defining mindfulness? What do we really think it is? And then we wrote this paper, and Scott Bishop was the lead author. He was, I think, a postdoc working with Zindel. And he later said, I don't want to be an academic, and he went to clinical work. But that paper is so highly cited. I think it has 11,000. I don't even know. Maybe it's 16,000. It's got a ridiculous number of citations. But that's how I met Shauna. So she and I were a couple of the only women there, and we were young. Like, I'm not even sure if I was 30 then. Well, I know how old I was in 2000, so I was 31. But Shauna was even younger than me. She's several years younger. And, people were looking at us like we were the research assistants, or you're like, where's the coffee, But that's how she and I met, and we really connected that weekend. And then we said we should do some work together. And so we wrote a paper that came out, I'm not even sure when, 2003 or 4, on mechanisms of mindfulness. Yeah, and that's actually a fairly foundational paper as well, where we talk about this model of intention, attention, awareness, the IAA model, and posited a bunch of mechanisms. And that was work she'd been thinking about for a long time. And so after that, we said, well, maybe we should write a book. Yeah, and Shauna had been in touch with APA Books, American Psychological Association, and she said we should write a textbook, a book, or something about mindfulness. And I said, okay, why not? And so, we spent a couple of years, actually. I remember going down to California where she lives, having writing retreats and lots of conversations around what do we think should go in this book and how are we going to organize it. And so we were very proud when the first edition came out in 2007. And looking back now, you're like, well, that was pretty early in the development of the field. Yeah. And so it became, I understand, a pretty foundational textbook for many people who were teaching graduate courses. And, we target it towards any kind of healing profession. In fact, we changed the name, the subtitle for the third edition to Integrating Mindfulness into the Helping Professions. And I believe in the earlier editions, it was psychology and the helping or something like that. We wanted to make it more broad because we think it is applicable broadly. Yeah, so that came out in 2007, and then it did well, and we were asked for a second edition, which we had to write in 2016. And so the updates in that edition, there was lots going on for both of us. So it wasn't as extensive an update. We updated the literature, but the format stayed similar. But then for this third edition, again, we were asked for updates, and we thought, you know what? Now is an opportunity to really dig deep, and we basically rewrote the book. And one of the most significant things we did was with a recognition of the importance of diversity, inclusion, equity, accessibility. Yeah, we said, we are not experts in this area. We, have the humility to recognize that it's important, but, we needed to consult with somebody who worked in that space and understood it much more. So we consulted around, we talked to Rhonda McGee, Doris Chang, some of our colleagues, who would you recommend? How should we do this? Like, should we add a chapter on DEI? Is that good enough? And in the end, we decided we wanted to infuse it throughout the entire book. Yeah. And so through many connections, we came to Broderick Sawyer, who's a clinician and an expert in this area of DEI. And so we worked with him going through each chapter and have him review it from a DEI lens. And okay, where does it come up? Where can we add this in? We added in specific sections about, implicit bias and, how people can use emotions brought up by racism and use a mindfulness practice to transmute these. And so he really helped us throughout the book include that sensitivity. So that was really amazing to have that addition. Yeah. And maybe
Yeah,
I'll
and
pause for a moment.
what I really like about that is instead of it being added as an appendix or a separate thing that people may skip, I really like that you made the decision to infuse this, to make it a part of how the entire book comes together, because then there's no missing it. And this is such an important aspect of, well, really any field. But we know we have, shall we say, room to grow in this
Mhm,
within the field
mhm.
of mindfulness. So putting that in there was wonderful.
Yeah, and having more of a trauma-informed perspective too, I think is really important as you're going through, like we have a chapter on, the different types of mindfulness-based therapies, right? And sort of foundational elements of the therapies and how a therapist can embody mindfulness in mindfulness-informed therapy, right? And so it's so important to bring up these ideas just throughout all of that.
Yeah, yeah. Now, I also, interestingly, you brought up the title, and this is something I wanted to explore with you a little bit, is there are two parts to it that I'm interested in that stood out for me. One was the title of The Art and Science of Mindfulness, and that's not something you would typically find in an APA kind of journal, that there's this acknowledgement that it's not just the hard science, there's also an art to it,
Absolutely.
but also the that integration into the helping professions, which is one of the areas that or where I've been working on for a while, is this idea that mindfulness is not something where you can just hand someone some scripts
Oh,
and, oh, then it's baked into my therapy practice. It's
mhm.
more than that. So I wonder if you could speak a little bit about each of those.
Sure, sure. I mean, the art and science part, I think, so Sean and I are both clinicians and researchers. I'm more on the research side. She's more on the clinical education side. But we're both trained as clinicians, and I've been practicing as a MBCR, mindfulness-based cancer recovery, which is an adaptation of MBSR. I've been an instructor continuously for 25 years. So you're reminded every time you're with a client that it's an art form. There's no formula for how to take principles we learn from the science of mindfulness and convey them to a person in a way that is going to be meaningful for them. And as you said, it's like, oh, time for the body scan script. Well, that's not effective, right? We need to really embody the practices in our own persons and convey that. And anybody who's in the healthy professions knows that therapeutic relationship is artful, you know. Yeah, but it's also really important to be evidence-based or evidence-informed. And I'm a huge believer of that. In fact, other things I do is generate clinical practice guidelines, for the inclusion of mind-body therapies in different treatment spaces, right? And I'm a researcher, so my philosophy has always been to work from within. I'm a little bit like a mole, right? But using acceptable standard methodologies like randomized controlled trials. I'm actually a bit of a methodology geek around clinical trial design. Yeah. So I've been doing comparative effectiveness trials, pragmatic trials, real world stuff lately. But really starting with traditional, tightly controlled RCTs. And so two of the chapters in the book are completely science-based reviews of the evidence. So one is on mental health conditions, and I go through everything, sort of in the third edition. It's very interesting because every time I go to update these chapters, you're like, whoa, like I can't. The first book, I reviewed every single study, pretty much. Yeah, because there weren't
And you
that
can't
many.
do that anymore because now
No,
there are just thousands of studies on this. And David Black is always, every year, posts on goamra.org
that to
that
that
new chart
table. It's in
and
the
how it's
book.
gone up. And this is the
The
first,
chart is
actually, this is
actually
the
in the
first
book.
year as of this recording in 2024. This is the first time it dipped a
Oh, it
little
didn't
bit.
go up.
Well, it went down a little bit in 2023. And
Interesting.
this is the first time since I think 2005, since there was a little bit of a dip, but we're still
Yeah.
talking thousands of them.
Oh, honestly, like I've got the chart in the book here. Let's see, where is
Oh,
it?
there you go. There you
Yeah,
go.
I gotta find it, but
Yeah, and that's
it's
something
in
that
there.
those of us who are in this field, we include that in our
There it is.
presentations about mindfulness. Yeah, that one exactly. So folks
And
are
this one just
noticing.
goes to, this has got 2022. So actually, even in 2022, there's a little bit of a plateau between 2021
Yeah,
and 2022.
yeah, yeah. And that shows that this is really a living, vibrant field of study. And to
Oh,
see that
yeah.
there
And
are,
so when I go to review the literature, right? So the first edition, every single study, Teasdale, they've done like the MBCT and that kind of work. And, and then, so that's the mental health side. And then there's also a physical health side where I go through all the conditions, diabetes, HIV, there was a few studies here and there. There was some organ transplant, some blood pressure, cardiovascular stuff, our work in cancer and others. And so then I go to update it in 2016 and I'm like, oh man, I'm like, okay, well, there's all kinds of meta-analyses now. Well, actually, not even too many good meta-analyses, but there's a bunch of systematic reviews, narrative reviews. So I focus more on those, just leaving the seminal studies, the really big studies. And then I go to review it like last year. Was it last year? I guess so. When we were writing it. And I'm like, oh my God, how am I going to do it this time? Like there's so many more studies. So, again, now it's more high level kind of, okay, let's focus on the meta-analyses or even what do they call them? The meta-analyses of meta-analyses. I can't even remember the word now, but what are they called? Where they actually take all the meta-analyses and reanalyze them all together, right? So this sort of higher level, in some areas, there's enough research to do that. I mean, it's crazy, right? And of course, there's nuance, right? But when I hear people say, oh, there's no evidence to support these treatments, it's all just new age mumbo jumbo, I think, are you kidding me? Like,
yeah, and
there's
that
so
stems,
much
I think,
evidence in some areas.
yeah, I
Yeah.
think from an innocent ignorance of I just don't know that there is research going on that because it might not be within their field or their territory. And so there
But
is,
you name a medical condition and somebody has tried, managing it or helping people manage their symptoms with a mindfulness-based intervention now.
right,
I'm
right.
honestly, it's crazy. Yeah.
And what I
Which
always
is,
find
it's interesting.
interesting about that is it's different levels, and you know this very well, different levels of quality that there may be a bit of a mystery about the training or competency of the teachers. They may not be mindfulness teachers providing these implementations. They may not have a personal practice, and that can influence the outcomes.
Yeah, for sure. I mean, and there's some studies like laboratory studies where they expose person to maybe 1 or 2 20-minute sessions of mindfulness and then, do brain scanning or whatever they're going to do. It's cognitive tasks or something. And then they say, oh, mindfulness influences that. I'm like, that's not mindfulness. It's like, anyway, so there's many different ways that the term is thrown around. So we're careful in the book. Also, we spend a whole chapter talking about what's a mindfulness-based intervention, right? And what do we mean when we use that terminology? And again, the research is getting more sophisticated because they're beginning to separate out, because there's so much research, you can say, okay, let's look at the interventions that are very closely aligned to MBSR or MBCT, versus kind of other ones that may be, shorter than 4 weeks in duration or not include certain modalities. And, so it is getting more sophisticated, our understanding of that.
Yeah, which is good to see because it's these are apples and oranges, and yes, they're both fruits. They're both mindfulness fruits, but they're very different kinds.
Yeah. And the issue you raise of treatment fidelity, the competency of the teachers and stuff. I mean, it's very hard to assess that. Beckett Crane's got the scale that they've developed out of Wales, but it's really hard to administer. Like you have to be trained in how to, administer the scale, right?
Right.
Like, so it's
Right.
quite difficult to do, like even in a research context,
Yeah.
and I've myself been involved in research projects where I got to watch all the videotapes and rate the treatment fidelity, which let me tell you is like one of those boring things.
It's really tough, and even parts of the MBI TAC, I have some difficulties with them.
Mhm.
Embodiment is a tough one.
Well, and there's inconsistency. That's the least,
Inconsistency.
inter-rater reliability is lowest on that one. Yeah, for
Well, we
sure.
also see some of the things I notice when I read through a paper that makes some kind of claim that raises an eyebrow for me. I'll say, oh, it's an MBSR. And then I take a look and I was like, no, this is not MBSR. They did not
Yeah,
actually adhere to that program. So let's talk a little bit more of the structure of the book. Maybe you could say some more about what's in there that people would
sure.
really like to get into.
And you know what? If you don't mind, I'm going to look at the table of contents so I don't forget
Sure.
anything. So it's divided into three main sections. So what is mindfulness? How is it applicable to clinical work is the beginning, right? And so we spend a whole chapter just talking about what is mindfulness and how we define it and a little bit of the history, so tying it in to the Eastern traditions, right? Because I find also a lot of mindfulness in the West, it's like it dropped into North America, in 1979 when John Kabat-Zinn showed up with it, and I find it's a bit disconcerting too that a lot of the people, when you ask them their tradition, their practice tradition, they say MBSR, right? And not understanding where that comes from. And I think it's actually quite important to have deeper roots than that, if you're a practitioner. And that's just my opinion.
It didn't spring out of nowhere in 1979.
No, it didn't. And so we talk a little bit about that, different, not to the level of, sort of Buddhist scholar, but a little bit of background there. And then the next chapter is the mindful therapist. So this is just the idea that no matter how you may or may not be incorporating mindfulness into what you're training people in or how you're interacting with your clients, just being mindful as an individual is very beneficial, right? So what does that mean? What does that look like? Right. So that's the embodied practice. That's having, a self-awareness, right? And then we go into mindfulness informed therapy, which is often overlooked, right? So many therapists, are not actually training their clients in mindfulness techniques like you do in the next chapter, which is mindfulness-based therapy, right? So mindfulness informed therapy is just where you have in your mind some of those concepts around mindfulness that you can use therapeutically when the opportunity arises. So things like impermanence, right? Things like acceptance. So it's almost more like the attitudes of mindfulness, non-attachment, letting go. Gosh, it's actually, I was looking at it.
Patience, non-striving, beginner's
Yeah,
mind,
but it's not even,
trust,
it's
acceptance,
actually,
letting go.
we go quite beyond that too.
Yeah.
Yeah. So in the mindful therapist, we talk about the common therapeutic factors, the attitude, self-attunement, empathy, those ideas. Cultural competence is in there now, emotion regulation. And then in the mindfulness informed therapy, so there's like no self. We even talk about how ideas around that. And for each concept, we talk about there's a case study about how it in some of our work, how we applied it. So yes, acceptance, of course. Transmutation is interesting because that's something Broderick added around how to take difficult emotions that arise from maltreatment or racism and not deny them or push them away, right? Or it's how to sort of transform them. So that's really interesting. And then we've got conscious responding versus automatic reactivity, of course, right? Which is like class 3 or class 4, depending how you do it. Paradox, interdependence, right? So some fairly higher level, ideas, right? Essential nature, this idea of the Buddha nature. So there's examples within that chapter about how to apply some of these concepts in an everyday therapeutic encounter.
Yeah, yeah. So as you just have some perspective on the book itself and this new edition, what are some of the things that you personally are most excited that are now in this version? Even if they were in there before, what are things that make you go, I'm so glad that's in there. Let me read that again.
Yeah, well, I love the chapter. So I love the research chapters, but they're pretty straightforward. But we also but there's a chapter on positive psychology and mindfulness, which I think is really great. So we're looking at those concepts around post-traumatic growth and spirituality. And I think we address in there, even one of my pet peeves is this prison of positivity, right? Just put on a happy face. And, whenever somebody says to me, I'm taking the mindfulness class because, I want to work on positive thinking. I'm like, well, you're in the wrong place.
Yeah, yeah. We're going to take a look at experience,
No
ones
matter
that
what it
you might
is.
like and ones you might not like so much.
Yeah. And so somehow there's a mix up in how mindfulness fits in positive psychology, right? And actually a misunderstanding of positive psychology in general in many cases. So we talk about that. And, a chapter I love that hasn't really even changed that much is on mechanisms of mindfulness. And so that's where we talk about this IAA model. And I love it because it takes a simple definition of mindfulness, paying attention in the present moment, on purpose with an open, accepting attitude. And it kind of parses it out more scientifically or more, breaks down the components of it. So I think of it as kind of the why, the what and the how, right? So why, that's our intention. And this concept, and there's paradox in intention too, right? As you know, right? We can't strive for a certain outcome or we'll never get there, you know? And I always use the example of like, I got to relax and try so hard to relax, right?
Yeah.
Gotta relax now. And so the only way you're going to relax is to just stop trying, right? You know, and just letting go. So our intention is very loosely held. It's high level, right? It's like, I really want to be awake and aware for my life. You know, I want to be there. I want to live it fully. But, you know, it's okay too if you just want to sleep better, right? You know, so you got to work with the paradox of intention, but you have to have some kind of intention, you
Mhm.
know, because that is what motivates the practice.
Yeah, and this is one of the things that shows up most often is, and why we ask typically at the beginning of an MBI, what brought you to this?
Absolutely.
For because we'll learn from that question first a little bit more about what that person, what their needs are, but also, okay, and here are some areas where we're going to, yes, this will support that, and areas where let's talk and explore a little bit more about what we're doing here to make
Yeah.
sure there's a
That
match
question
and that
is
we can
fun, right?
support the person.
Because
Yeah.
people be like, oh, I can't meditate. I'm terrible at it, you know, or I got to learn how to clear my mind, you know, and so you see all the misconceptions right away.
Yeah.
Um, yeah. And we always go back at the last class and say, remember what you said brought you here or what you were hoping for? You know, how has that evolved over the last 9 weeks or however long?
Yeah, it's one of my
Um,
favorite questions in an MBI is
yeah.
that transformation, that shift over time as you start to learn and practice and discover new things that were unexpected.
Yeah, and that always happens. So where was I at? So intention, and then so that's the why. The what, right? That's the attention practice. That's the training in mindfulness. And you know, there's been this disconnection. When I first noticed it, I was quite shocked. It was a journalist who said to me, "Oh, I'm interested in this, you know, explosion in mindfulness." And she says, "I think mindfulness is more accessible than meditation because you don't have to meditate." I know, and I was like, "What?"
This is how to get fit without doing exercise.
Yeah.
No,
So there is a
no.
misconception that mindfulness is just something you can do, you know, because you think it's a good idea, right? And so I always present it as a skill. You know, we have to build the skill of the, you know, the capacity to pay attention in the present moment. And that's the what? That's what we do. We train our minds through regular practice, both formal and informal. You know, so that's sort of the heart of the practice is the what we do, but then the second A, attitudes, that's how we do it, right? So why are we doing it? What are we doing? How are we doing it? And that's so important because you see that in the first class too, is just how hard people are on themselves and impatient. Actually, it was super funny. I just did class 2 and a guy showed up, you know, he was supposed to do body scan all week and he just said, "Oh man, it's like it's taking so long." And, and I find myself, I just like, I want to go on to something else. And he's like, "I don't understand what," you know, he was so impatient and it was great, right? Because really opened up such a good conversation.
Yeah, that's what we find in the practice. That's part of the exploration of it in week 2 is so it showed up. I was impatient. I had a hard time doing it. Ah, what was that like?
Yeah. And also, I always bring up the idea at some point about the meditation practice being a microcosm of your life, right? And people, it always gets a laugh. I say, you know, so you're impatient in your practice. Is that something that you struggle with in daily life? And there's always a smile of
Yeah.
recognition because it always is.
And we could talk about this all day easily throughout the weekend. So, in respect of your time, because I know you're very busy, wondering what else you would like to share with the listeners, either from the book, your other work, anything you would like to talk about.
Yeah, you don't want to open that up too widely, but you know, it's actually really fun talking about the book, and I hope that people get an opportunity to read it. You know, I love to have conversations around the work we're doing in the integrative medicine space. You know, that's a bit of my passion these days. I'm past president at the Society for Integrative Oncology and involved in the academic consortium for integrative medicine and health. So, you know, really for me, what's motivating me now is bringing these practices into medical care in a routine way. So we've been working on clinical practice guidelines through the Society for Integrative Oncology and the American Society of Clinical Oncology, which is an amazing coup because this is the largest group of oncologists in the world, mainstream oncology. And they've endorsed, in fact, we've partnered on guidelines which say And the highest level of evidence in these guidelines for treating anxiety and depression and fatigue, so we do it by symptom. And the wording in a guideline can be should or may. And the wording in the guideline is mindfulness-based intervention should be offered to people with cancer, both during and post-treatment. Full stop, right? So seeing, the progression of these kind of interventions from our first study, my first study was published in 2000. And so almost 25 years later, like seeing, as we said, hundreds and hundreds of studies supporting the efficacy of these interventions. There's much more work to be done in terms of diversity, and that's really important in looking at, different types of people with different backgrounds, different types of illnesses, et cetera, et cetera. But to see things now, and of course, we look at MBCT at the National Health Services in the UK, right? And how that's been implemented as first-line treatment for managing, depression relapse and mood symptoms. I mean, I think that's exciting to see where the field has gone with the with guidelines, and now working on implementation of guideline recommendations, right?
Right. And so helpful to see research that shows here's how this is compared to treatment as usual. And there's so often a dismissal of treatment as usual. It's like, no, that's what people are getting today. And
yeah, for sure. And actually, I mean, you make a good point, right? Is that, it's true that, treatment as usual is what's the standard. But from my perspective as a researcher, I'm like, well, of course it's better than quote unquote nothing, treatment as usual, right? So the kind of research that I like to do and that I, sort of encourage people to do is comparative effectiveness research, where we're actually comparing whatever our mindfulness-based intervention is to the gold standard, which is usually CBT or something like that, right? So I think, and I've done studies, like you could compare it to, say, exercise, or you can compare it, like Liz Hoagie has just compared mindfulness-based stress reduction to an anti-anxiety medicine for patients with generalized anxiety disorder, right? So showing how does it, stand up against, medications, antidepressants, like anxiolytics, right? I mean, it's pretty cool. And the mindfulness-based interventions are looking pretty good, right?
Yeah, it's good to see. And that's one of the research studies I share in one of my programs is how MBSR compares to escitalopram for anxiety. And that carefully worded comparison, which of course, understanding, need to do that as well.
Well, and in the clinical practice guidelines, again, in oncology, the mainstream guidelines for anxiety and depression, like not the integrative guidelines, which are separate, the mainstream guidelines also include mindfulness-based interventions. And they say first-line treatment is behavioral, not pharmacological. This is for depression, right? So, and the first-line treatments are mindful, MBSR, MBCT, right? As well as, cognitive behavior therapy and behavioral activation. Like those are first-line treatments. It's pretty cool.
It is. It's so wonderful. Oh, Linda, thank you so much for being here. And again, for people who are watching or listening to this on whatever platform you're on, I do have several links in the description. And one of those links is to this third edition we have been talking about here. Linda Carlson, thank you so much for being here. Good to see you.
Yeah, super fun to talk about this stuff. Good to see you again, Ted.
Special thanks to Linda Carlson for being our guest today and exploring more about the science of mindfulness and a bit about the art of it as well. There's a lot there, as you can tell, and I do recommend ordering that book. That third edition has some wonderful updates to it. And please, if you got something out of this podcast or other episodes, be sure to subscribe. It helps other people find this as well. Remember, until next time, every moment you have a choice. Make it the best you can, and I'll see you next time on Mindfulness Voyage.